Okay, we're going to begin the peripheral vascular exam. I'm also going to include the cardiovascular exam in the peripheral vascular physical examination. Okay, we're going to start with the cardiac exam, and first I'm going to be inspecting the patient. I'm inspecting the JVP, I'm inspecting the pericardium, I'm looking at the contour and the symmetry and shape of the chest. If you could lay your hands by your side. And I'm also going to be looking for any pulsations, any beat pulsations, and any thrills or heaves. First, I'm going to look at the JVP. I'm going to have the bed elevated to 30 degrees. And I'm going to be looking for the JVP and looking for the pulsation. And I see the pulsation. And so then I'm going to measure it at the sternal angle. I'm looking at the lowest point of the pulsation, and I'm going to measure it. And then I'm going to find the sternal angle and measure the sternal angle. And I want this to be less than 3 centimeters, and it's measuring at about 0.5 centimeters, so that is good. And now I'm going to be palpating, and I'm going to be palpating the carotid artery. And I'm going to palpate the opposite side. And while I'm palpating, I'm going to start palpating for the aortic area. So I'm going to find the second intercostal space, and that's the aortic area. Then I'm going to move over to the left second intercostal space. That is the pulmonic area. Then I'm going to move my fingers down to the third intercostal space. That is Erb's point. The fourth intercostal space, that is going to be the tricuspid area. And then I'm going to move down to the fifth intercostal space and the midclavicular line, and I'm going to feel for the PMI pulsation. And while I'm here, I'm going to go ahead and palpate some pulses. I'm going to palpate the brachial pulse and the radial pulse, and the brachial pulse here on the left side, and then the radial pulse on that side. Okay. And now I'm going to, while I was palpating those pulses, I was noting the upstroke and the brisk and the contour of the pulses. We want those to be less than 3. Now I'm going to start auscultating. I'm going to first check for any bruise in the JVP area, and then I will auscultate for the S1 and the S2 in the pericardium. First checking for any bruise. And what I'm listening for is the turbulent blood flow. We do not want to hear any turbulent blood flow. I didn't hear any bruise, so now I'm going to auscultate in the aortic area. This is the second intercostal space. I'm listening for the love dove. I'll hear the S2 best in the pulmonic area. Right now I'm around Erb's point. And then I'm going to have the patient roll to his left side just slightly while I'm listening with the bell of my diaphragm. And here I'm going to be listening for any splitting or any extra sounds, any S3s or S4s. Okay? And I'm going to have you lean up a little bit. Sit up. Slightly. I'm also listening for any extra sounds. Okay, keep going back. So that was the cardiovascular exam, listening to the S1 and S2. And I'm now going to be finishing up the peripheral vascular examination. And with the peripheral vascular examination, while I was feeling for his brachial and radial pulse, I was also inspecting the skin for the temperature and any color changes that I might see in the skin. Now I'm going to finish doing the peripheral pulses. I'm going to check the popliteal pulses over here. I'm going to check the dorsalis pediis, the posterior tibial, and same on the other side. And I was also noting the upstroke and the contour and amplitude of those pulsations. Now I'm going to auscultate and listen to the aortic, the renal, iliac, and femoral, any bruits in those areas. Also, I would check the femoral artery, the pulsation, which would be on both these sides in the inguinal area. So I'm going to use the bell of my diaphragm. So we're going to do the aorta, below the costal vertebral area, and then the renal just above the umbilicus, and the bifurcation of the renal artery on both sides. And then the iliac just below the umbilicus, and I'm listening for any bruise. Now I'm going to do the Allen test on my patient, and what I'm going to have you do is to open and close your hands and just pump it like that. And then I'm going to have, while he's doing that, I'm going to hold the radial and the ulnar arteries, and I'm going to ask him to make a tight fist. And then I'm going to ask him to open his hand, and I'm releasing the ulnar aspect of the artery, and I'm watching the blood fill back up in his hand. And then I'm going to ask him to do the same thing again. And close your hand. And I'm going to release the ulnar aspect and ask him to open his hand, and I'm going to watch for the blood to fill back up in his hand. And also, while I'm here, I'm going to do the capillary refill check, making sure that his nail beds are getting pink after I indent them, and then making sure they fill up within less than 3 seconds. Do this for the toes of the nail beds as well, on each side and each hand. And that will complete the cardiovascular and the peripheral vascular examination.